Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to have a hard conversation about the media and mass hysteria, something called nocebo, and COVID and coronavirus infection. And I think we need to start by saying that there is very clear that there has never in the history of man ever been anything that has ever been looked at through an electron microscope like COVID has. That goes from symptoms, which may or may not have anything to do with COVID, but somebody had COVID at the same time that their left arm fell off, and so, oh my God, now everybody thinks that your arm's going to fall off when you get COVID. People who, like a 25-year-old who died suddenly from COVID, which doesn't happen. And then you later find out, if you dig back through the news, that, oh my God, they fell off a building, and that's what they died from, not COVID. But you never actually find out that that's the case. You just hear the initial shock value. Humans are generally geared towards negative information, and that's probably built into our survival. But there's this concept called mass hysteria that when we hear bad news, it can have a physical effect on us. This is very clear in examples that have happened in the past. Things like TV shows of a virus. There's just constant examples where something that shouldn't have happened, it probably started as early as War of the Worlds. If you remember the panic that ensued from, most you probably don't remember it, but you've heard about the panic that ensued after the radio station played War of the Worlds, and people panicked because they thought that we were actually being invaded. Most recently, in 2018, there was a plane where several of the people were ill. By the time the plane landed, a huge chunk of the population in that plane were ill. They had to quarantine, and it turned out that it was really just a handful of people that had common cold. But the hysteria that drove that plane ended up quarantining those people when the plane landed. So it happens. And when you start combining that with the amount of information that we have been bombarded with COVID, it probably makes that even more of a crazy concept. Then we look at something called nocebo. Most of us have heard of placebo, and that is the idea that we can have an effect of something because we think it's going to help. But on the flip side, a nocebo effect happens when we believe an intervention can cause harm. So that means that if we're taking a drug and we think that that drug can cause harm, we're more likely to experience that harm, even if we're taking a placebo. So that if you're in a trial and you think you're taking the drug, then you're actually going to have side effects of that because you think you're taking the drug when you're actually taking the placebo. So and we've known that this is not a new phenomenon. I remember reviewing a study on migraines where people, they played around with who was getting what and what they told people, and like the mind is a huge driver of symptoms. So what does this play into? This is all driven by a very nice article that you really should read. It's in a scientific journal, but it is written in a very well understandable way, and it's probably good reading for everybody. And they're talking about how mass media and the public response likely drove worse outcomes, because stress is clearly a player, and what we've done and our response to everything that we've done may have made everything far worse. Talk about putting everything in context, where the probability of dying from COVID is really low. Depending upon your age group, that number is still low. It is globally, it's way below many other causes that have been around forever, and we don't panic. And I've tried to get people to understand this, but the response is always, well, it's a pandemic and it's an infection. But if you die of a sudden heart attack or you die of COVID, you're still dead. But we didn't panic about the sudden death from heart attack because it's not infectious and we didn't expect to die, but tell that to the 40-year-old or 50-year-old that died suddenly of a heart attack. And to put this in perspective, how many people do you know in the past year that have died of COVID or have died of cancer or heart disease or dementia or anything? If you think hard, those numbers are still in excess of the people who have died of COVID, but this whole environment that surrounds it has been crazy and driven this mass hysteria that may have made everything worse. To put that in perspective and to drive those numbers home, there was a study looking at people who had COVID and symptoms associated with COVID. 30% of them actually developed PTSD symptoms that qualified as a PTSD diagnosis. That's not from the virus. It's not from the symptoms you had. It is likely from developing coronavirus, developing COVID, and then your worry about everything that you've heard from everywhere that drives the psychology behind this. Look at some post-COVID symptoms too. That's got to play a role in this. And I'm not saying that those symptoms are not real, because it is absolutely possible for psychological effects to have physiological effects. We know that with blood pressure medication. We know that it's very real. But how much of this would have happened if we didn't have social media, if we didn't have the media, and how much of it we were completely, absolutely nonstop bombarded with largely negative information on COVID and the possible effects of our arm falling off if we happen to walk by somebody in the grocery store that's unmasked and asymptomatic. Really just pointing out the information that's in this particular article. It is really phenomenal reading to put everything into response. How we are now in a situation because of social media, because of the media, because of the internet, that our response to COVID has been, our exposure to information about COVID, largely negative, has been different than anything else that has ever hit us ever in the history of man, and we need to put that into perspective. So as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.